I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today we're going to look at masculinizing without surgery, that first glance at the face and body. You know, I've known for a long time that people don't work that hard to determine whether another person is male or female, but they do look at specific cues and they make snap judgments based on very stereotypical things. Stereotypes of male and female are everywhere. Let me show you this picture a little bit enlarged here. So here you see a variety of different ways that maleness is represented. It's quite a variety. Just as with feminizing, start by looking at features that scream male from across the room. Now, height is one of these. You know, we always seem to think about males as being taller and usually about 6 feet or higher. But you know, the actual average US height for a male is 5'7". We look at a broad jaw. We look at the Adam's apple. Scalp hair patterns, a receding hairline, for example, or balding are very typically male. Facial hair, a flat chest, broad shoulders and a muscular build, and body language and a gait and stride that sort of convey male are things that we all know to look at. So first of all, let's look at how the male skull and the female skull differ. Let me enlarge this for you again. So these are Dr. Osterhout's slides. At the left, you see a male skull. At the right, a female. Note how the difference in the bossing of the brow bone. First of all, identify the orbits where the eye sockets are. And right above that, you can see a very prominent brow bone on the picture at the left and a softened brow bone on the right. Similarly, you'll see a broader jaw, stronger appearing jaw on the male picture versus on the female at right. So bone structure can be modified in facial masculinizing surgery. So this is the equivalent of FFS. This is FMS. So think of the reverse of FFS. We think in terms of augmentation of the brow bones, augmentation or filling out of the cheekbones, augmentation of the jaw to create a more prominent and broader jaw, and then the creation of the Adam's apple. Did you know that surgically the Adam's apple can actually be created by the use of rib cartilage? In the short term, however, brow bones, cheekbones, and the jaw can be accentuated with dermal filler or accented with the use of cosmetics.